Alex, thank you so much for joining me this afternoon for this Vintage Vet Nurse interview as part of our series of interviews that we're doing to celebrate 20 years of VNAM. So interviewing nurses that have been in the profession for that length of time at least, to give us a little bit of an overview of your experiences of your nursing career. So would you mind starting by introducing yourself to us all? Not that you need much introduction.
Yes, of course. So my name is Alex Taylor and I'm a registered veterinary nurse. I qualified in 1997 and I've spent most of my career working in small animal first opinion practice, clinical practice, but I've done a bit of teaching sort of around the sides as well. And I currently work for the charity International Cat Care and I have done for the last 2 years. But yeah, most of what I've done has been in sort of your average first opinion practice, really. Yeah.
So you're also a past president of the BVNA.
I am past president, yes, and had 5 years on BVNA Council, which was great and very enjoyable.
And you also have a social media platform as well, don't you? Whereby you obviously educate people in all things cat. And that's not just veterinary specific. It's not just open to people who work in the veterinary profession, is it?
No, so I started my my cat nurse social media platforms around sort of 7-8 years ago now, depending on which one you sort of go on to. And the idea behind that was to keep veterinary nurses sort of updated with what I was up to and provide a bit of education to both the public and the veterinary profession about cat welfare and cat behaviour. And they've just sort of grown since then, really.
And do you enjoy it?
I do enjoy it, yes. It does get a bit of a challenge to manage when it's just one person, me, managing them all. So I just do it when I can. But you know, I've had some really good feedback from the public and from my colleagues about some of the information that I've provided. So it's a really nice feeling when you know you've put that effort in and people appreciate it and have found it useful as well.
It's really useful for me as well, because I know in my work setting, if there's anything I'm unsure of, I'm like, we'll ask the cat nurse about that. She'll know. And also, like, personally, talking to you about my own cat, you know, sort of things that, because I think sometimes when you I don't know, I was talking to another nurse about this earlier. When it's your own animal, sometimes you lose a bit of like perspective, don't you? And all of those skills that you have just suddenly disappear. So you just need someone to talk it through with. And I've done that a lot with you, with Mo. So it's been
little old lady, bless her. She's made quite a few appearances, hasn't she, in my lectures over the last sort of year or two. So she's helped me as well.
Oh, good. So the next question is quite a big one, really. So what progression have you seen in the veterinary nursing profession in the last 20 years? It's a big question.
It is a big question. I think I'm going to probably say in the last 25, 30 years, because that's been my career sort of, you know, that's been how long my career has been.
Yeah.
I think, you know, obviously now we're all registered veterinary nurses, so we follow our code of conduct and we're accountable for our own actions.
Yeah.
And you know, some people might not realise that was relatively recent as well. That we all now have to be on the register, and nurses since 2012, nurses have had to, you know, make their declaration and follow a code of conduct.
Yeah.
Which I think kind of since then we've moved from being an assistant to the vet, which we are still in many ways, to much more of a profession in our own right. And I think that's when nurses started to look at different areas where they could go into more, because traditionally it's been, you know, you get qualified and then you're either head nurse or you just stay as you are, and that was it. You'd hit that ceiling and there was nowhere else to go. Whereas now there's lots of places to go, and they're not always clinical. They could be in a role like, you know, I'm doing for a charity, or people, you know, nurses work in research now, they teach, they might work for a pharmaceutical company. That, you know, as you know, there's like so many different things nurses can do. Have to be clinical. But even within that clinical role, I think now there's so much more that nurses can do, and there's a lot more qualifications. I know we've obviously got the RCVS advanced qualifications, but there's lots of other qualifications as well that nurses can do, and then take that information and use it in their role in practice. And whether that's as a general practice nurse that's doing lots of different things, or whether that's someone that just wants to work in one area, say just consulting or just surgery.
Yeah.
I just feel like we've become very much more a profession in our own right
Yeah.
the last
Do you
20-30 years.
do you feel alongside that you're able to give a different perspective to the care of patients and that you're listened to more than you have been before?
Yeah, I think so. I mean, I think, there is a certain element of practice culture as well involved in that.
Yeah.
I do think it's really important. The team work, like that interprofessional working, is really, really
Yeah.
important. And that's everybody. So that includes vets, nurses, the reception team, your care assistants. Everybody is involved in the care of their patients.
Mhm.
But yeah, I just feel like, Sally, so for me, with my cat behaviour hat on, when I work in practice, which isn't that often anymore, but certainly when I was doing more shifts in practice, I would be the go-to person to give that advice.
Yeah.
And it would be everybody, not just the other nurses, it would be the vets as well.
Yeah.
And I think it's nice to sort of have that autonomy and to take ownership of
Yeah.
those roles where you can use that knowledge that you've learned. And I think nurses are doing that so much more now than ever before.
Yeah, I think you're right. I think that's certainly one of the biggest things. I think that changes that I've seen is not only the diversity in what nurses can do, but that I feel like I can have a conversation with somebody now and my viewpoint is listened to or taken on board. But I would agree with you. It's not always the case. It does very much depend on the practice culture. And I think there are things that we should be doing or we could be doing in practice as leadership to help support bridge that communication breakdown, or that, why it may be that someone doesn't feel like they can have that conversation and be heard, or so I think that's certainly, just through conversations I've had with people, I think that there is still an element of that, isn't there, in some cases. And I think we can do something about that. I don't think we should just sort of sit and say, well, this is how it is, it's how it's always been. We can definitely be part of solving that problem.
Yeah, absolutely, to be part of that change. And some of it, I think, is down to awareness about what veterinary nurses can do.
Yeah.
There's still some people out there
Yeah.
that think that we're not accountable for our own actions, and so there's that side of it. But then, like you say, there is a certain sense of responsibility with each individual veterinary
Yeah.
nurse to actually say, look, this is what I've done. This is the extra qualification I have, or this is the extra knowledge I have. Share it with their teammates. But help to build that trust. I think it's trust, isn't it?
Trust. Yeah, absolutely. Yeah.
Trust
Yeah.
that person that they're going to do X, Y, and Z right.
Yeah.
I think we're getting there though. And I think back to when I first
Yeah.
qualified, it was all about getting that green uniform, wasn't it?
Oh, massively.
Yeah.
And I think sometimes, I don't know about you now, but we don't have that well, we do still have the green uniform, the differentiation. But certainly it was a big thing for me when I was coming into a student role about getting my stripes to begin with, and then changing from my stripy uniform into my green uniform. So, and I had a conversation, sorry, I'm going as I do normally off on one. But I was asked to change my uniform colour when I became a director so that I stood out from the rest of the nursing team, from green to grey. And it was such a big struggle, even though there was a real change in my role and I knew the reason for it. I'd worked so chuffing hard to get that green uniform that it was, yeah. To which point, my rest of my directors are all vets are sort of looking at me like, you're making a big thing about like this green uniform, but because they just couldn't understand it. But yeah, you speak to other nurses,
though, isn't it?
Yeah, they get it.
I remember putting mine on the first time and it felt so weird. In fact, I remember having the conversation about whether nurses should be allowed to wear trousers or not. That was a long, long time ago, obviously.
Yes.
But having to, not a big struggle, but having to really put our case forward for like why nurses should be allowed to wear trousers. So I don't want to sound too much like an old fuddy-duddy, but Yeah.
Funny, my first job, we had dresses, and we were having some conversations with student nurses at the last BVNA business planning meeting that we had, and they were aghast at like some of the stuff we were saying. They were like, "Well, how did you like restrain?" Because I was like, they weren't, they weren't tight, but they weren't particularly forgiving. I was like, if you needed to straddle a dog to restrain, then it would be difficult. Apologies, my spaniel has just started barking. I'm just gonna
On cue.
So yeah, it was quite interesting, just that conversation about the things that we used to do. Yeah, when she asked about straddling, how do you, I was like, it was doable, but you just had to obviously pull the dress up a little bit and
Yeah.
make do. But yeah, it was really interesting. And I used to have to, I don't know about you, but I used to have to wear like we used to have to wear smart shoes as well, which were
Yes,
really
clogs
like
we used to
leather
wear.
shoes. Yeah.
Clogs, and when I first started, there was a white pin, like a white apron that used to pin to our top.
Yes. Yeah.
Well, pin to our dress, and then we had different color belts as well, for a student and for a qualified nurse. So I didn't have the hats though.
Oh,
I
I
didn't
see. I didn't have
wear
the
a
apron.
hat.
I didn't have the apron, but I can't imagine that would have been particularly practical. It was white, I'm assuming, your
It was
apron.
white, which meant it
Yeah.
got dirty very, very quickly, which I guess that's the idea, is that you changed it, but
Yeah.
I used to get stabbed by the safety pins quite a lot, because it's probably not that safe to wear those. But yeah, a lot's changed with that, and and with nurses being registered, and as I said, being accountable for our own actions. And I don't know, I feel like that was quite a big turning point for the profession, actually, and that's really
Yeah.
that quite recent. Not
Yeah. Yeah.
that ago.
So where do you see the future of veterinary nursing going, or where would you like to see the future of veterinary nursing going?
Well, I think it's going in the right direction,
Mhm.
absolutely, and has been, because of the changes I've seen in my career.
Mhm.
I think we really do need the Veterinary Surgeons Act to change. You know,
Yeah.
everybody knows we need it to change. It's out of date for the whole profession, not
Yeah.
just veterinary nurses. But we really need that legislative change so that we can start to do more in other areas. It affects a lot of things. We know the title needs protecting, and we've been campaigning for that for a long time. But
Mhm.
there's other areas that need to be looked at more, to do with anaesthesia, and just around the role and what we can do. And I'd love one day to see, an advanced practitioner nurse, where
Yeah.
we have that extra responsibility to do things, or in specific areas of veterinary nursing. And of course, there needs to be the right amount of training and qualifications to do that, for nurses
Yeah.
to do that. But I do think there'll be a really big appetite for veterinary nurses to get those additional qualifications, and to start doing more. Uh,
Yeah. Yeah.
and I think previously there's been worries that, oh, you're going to be treading on the vet's toes and doing it, but it's like, no, no. This is about evolving the
Yeah.
profession, not about treading on anyone's toes. And often with those things, there can be a little bit of, I don't know, apprehension at first, but when people see how beneficial it is for a practice, then yeah.
Yeah. And
Um,
I think as well, when you look at, and it's not like say, it's not replacing the vet. So my sister is an advanced clinical practitioner in the NHS.
right.
And I think, the opportunities that she has had, and I think, well, it supports the wider team. It supports patient welfare, which is what we would be looking to do. But it also allows the doctors and the other members of that medical team to do what that they should be doing. And like you say, it's about um, not specializing, because that's not a word we like to use, but having somebody who's got the skill set, an appropriate skill set, to be able to take whatever that might be, and have that opportunity for development and progression, like we talk about. And I know obviously we've still got a big way to go yet, but I think, and don't get me wrong, I don't think, not to start a big debate here, that the NHS has got it completely right all the way in which it is
No,
in the
no,
field.
no.
But I do think there are things that we could take from them to,
Yeah.
be a bit more open-minded and aware of sort of the role of veterinary nurses and what they could play. So
Well, we'd still be part of the vet-led team. It's not
yeah,
like anyone's going to
yeah,
go and start doing stuff without being under the sort of direction of a veterinary surgeon.
yeah,
It's not about that, is it? I think that's quite a narrow-minded way to
yeah,
look at things. It's really about evolving the profession, as you say, to help the wider
yeah,
team and to
yeah,
help our patients and pet owners as well.
yeah. Absolutely, brill. So, one other question I wanted to ask is obviously, sometimes you see, for all of the, for those of us that may be involved, you can see sort of the positive step forwards, and you understand perhaps maybe sort of the time constraints on things. But what's your perspective of sort of the viewpoint of some people who may feel like there actually hasn't been a great deal of progression, or that things take a long time to progress?
Yeah.
Just wondered if you had any thoughts on that.
I think it's very easy, isn't it, to look, understandably, you know, our job is a great job. Veterinary nursing is a fantastic role, and there's never a dull day, is there? Whichever role you're in. And sometimes there can be quite a lot of pressure with that, you know, emotional pressure, and people can feel a little bit overworked, and we know that burnout can be a problem and all this kind of
Yeah,
thing. But I think it's about looking at that wider picture
yeah,
as the profession as a whole, and it's also I can't remember what I was going to say now. I was going to say something along the lines of, yeah, I guess just looking at how we've developed overall as a profession, and not just because it's easy to be quite insular, isn't it? And just to
yeah,
look at yourself. And I understand that if you've had a bad day, and we've all had a bad day, haven't we? Let's
yeah,
face it.
yeah.
And we've had that extra pressure. But I think if you want to, and I've always said this, even when this is why I joined council. It's like if you really want to see change, then you need to be part of that change. So
Yeah,
you need to have a voice, and you need to fill in the surveys, and you need to keep an eye on what's going on in the profession.
yeah,
Because if you look at the bigger picture and you look at what's happened in the last 20 years, actually loads has changed. I mean, I
yeah.
would actually encourage people to look at the RCVS 60-year Jubilee anniversary video.
Yeah, it's a good idea.
It's a really good way of, you look back and you're like, wow, look what's changed in the last 60 years. And a lot of that's been in the last 20, 30 years as well.
Yeah, yeah,
So I would encourage people to do things like, you know, put yourself forward for BVNA Council. It's easy to think, oh, nothing ever changes. But from one week to the next, probably not a lot will change. But actually, from 1 year to the next, it does.
yeah,
But you need to be actively involved in that change somehow. You know,
yeah,
whether you're on council or whether you're doing something to be part of, I don't know, VN Futures, or whether you're just at least reading your BVNA and RCVS newsletter, you know, just keep an eye on it.
yeah, yeah,
Why look outwards and not look inwards is what I'm saying, I suppose.
yeah,
Sorry, I've
yeah.
said that in a really long-winded way.
It's brilliant.
But yeah, that would be my thoughts on that.
Thank you, Alex. And then the very last question, and I know we've already talked about it, but just to end on, would you be able to summarize what protect the title means to you?
Ooh, that's a very good question, because it means a lot to me. As you know, I'm very passionate about it.
Yeah.
Okay. So can I say there's probably two main things. One is about, by protecting the title, I think it will protect animal welfare and the public as
Yeah.
well, because they'll only have a registered properly qualified, trained, registered veterinary nurse looking after their pet. So from an owner and pet point of view, I think it's really important. But from the profession point of view, I think it really comes back to feeling valued.
Yeah.
And I know that that's been an issue in the past, with nurses feeling like they're not valued. I think that is slowly changing and evolving, because we're doing so much more, like we were saying earlier.
Yeah.
But I know not having our title protected, so anyone can call themselves a veterinary nurse, is a bugbear for a lot of veterinary nurses, and I understand why. You know, I get it. You
Yeah.
want to feel valued, and you want to feel like all that work you've put in with your training and any additional CPD or qualifications has, you know, for your patients actually is important, because it is.
Yeah. Brilliant. Thank you. That was brilliant. Thank you so much. And I know how busy you are, so I really appreciate you giving up your time to have a little chat with me this evening now, actually.
That's all right. You're most welcome.
Thank you, Alex. And we'll speak to you soon.
Thanks. Bye.
Bye.